You're watching CTOM TV. Knowledge is power.
So now there's also a few different other pathways that are being used right now to look at that have drug targets for them.
Okay.
Another one's called LAG3. This is called the lymphocyte activation gene 3. And this suppresses T cells and cytokine secretion. So the activation stage.
Okay.
So as if you recall, the APCs also cause the T cells to grow and divide before they go out and attack the tumors. Well, the LAG3 actually suppresses that process of growing and dividing. Then there's also ICOS, which is called the inducible T cell co-stimulatory.
Okay.
It's expressed on T cells, but it's expressed on activated T cells. So it's part of the activation process again.
Okay.
So when it's overexpressed, it prevents these cells from being activated. So there's all these checks and bounds to make sure the immune system does not run wild.
Right, yes.
Then there's also another one called TIM3, and that's called the T cell immunoglobulin and mucin domain containing 3. And then there's another one called EDO, and EDO has there's a few drugs out now for EDO. That's called the indolamine T3 dioxygenase, and that's something on tumors and APC cells, and it's on tumors and APC cells, antigen presenting cells, and it prevents T cells from functioning in various ways. One of them is through limiting a certain amino acid called tryptophan.
So this is not part of the activation process?
Yes, that is actually part of the activation process too.
Okay.
Yeah.
All
So
right.
most of these other molecules are part of the activation process.
Okay.
Some of them interfere with the ability of the antigen presenting cells to present the antigen to the TILs. They
Right.
all work in different ways, as you
Okay.
can see.
Thank you for watching CTOM TV. Subscribe below and stay informed.